Patrick. Now, Debbie, welcome to the programme, and we're going to get started off here talking about patient safety.
Yeah, good afternoon, everyone. And yes, Dr Henrietta Hughes at last has got a website, and I would like everyone, please go and have a look at her website. This is the front page, and she says she's there to listen to patients, which clearly we know that she's not doing, but she also highlights Parliamentary and Health Service Ombudsman. It's apparently staggering her that there's a patronising approach to patients. So let's go and have a look at the report. And this indeed was just brought out in June. And I thought I'd just go and have a look at inside very quickly. I just want to really direct people to this, to go and actually have a look at it. So that let's see what they found. The forward includes a few findings: failure to make the right diagnosis, delays in providing treatment, poor handovers between clinicians, failure to listen to the concerns of patients or families. I mean, the report is called Broken Trust, Making Patient Safety More Than Just a Promise. And clearly this is a damning indictment. And I just put a screenshot of a few of the findings and the comments that you can freeze the screen. And you can see there, look, lack of support to navigate systems in the aftermath of an incident, failure to make the right diagnosis, inadequate apologies, unsatisfactory learning responses. Clearly, all of these reports are coming out and nobody appears to be learning anything. But one thing you can find on Dr Henrietta Hughes's website, if you want to, go to her conference, which she's holding on patient safety in September. But I will warn you, thank you to Cheryl for pointing it out, it will cost you £699 to attend. Also on Dr Henrietta Hughes's website is Dr Alison Cave's blog. Yes, she's writing a blog, and she's writing a blog on about pretty much the value of submitting a yellow card. And we all know the reality of submitting a yellow card. So what does she say? She says, once a yellow card report has been submitted by a patient or healthcare provider, it is carefully analysed by our safety experts, who include doctors, pharmacists, scientists, and medical device specialists. Their analysis involves an assessment of the data to determine if the reported event may be a safety signal associated with a medicine or medical device, or it would have occurred anyway without medical treatment. This is because the nature of yellow card reporting means that the reported events may not be side effects or adverse incidents. It is important that everyone continues to report, even if they are unsure of if their reaction is associated with the medicine or medical device. And then she goes on to say that they have a two-way system of communication, but clearly that two-way system of communication is just between the MHRA and their scientists, of which we know they've only 40. There doesn't seem to be any patient interaction. So the Patient Safety Commissioner website exists. Please go and have a look at it and look at that report. Now, jumping on very quickly to the NHS, I'm not going to stay too long on the NHS this week, even though we should all be singing happy birthday to it, because I'm going to devote my next week's blog to the birth of the NHS 75 years ago. And this week we seem to be having party celebrations to perhaps celebrate the death of the NHS as I see it. But of course, Rishi Sunak, there's been lots of stories this week. Rishi Sunak and Steve Barclay have been jeered, and they've not had a good reception, but they've decided to give the NHS, as we know, a present of a massive workforce. Now, before we get too excited, let's look at this workforce, and they're pledging that it should grow by almost 1 million by 2036. And I'm not quite sure who they're going to be training, but it seems to be that the training is going to be reduced for most professionals. And I thought, anyway, the NHS was being taken over by robots. And to celebrate the birthday of the NHS, what better article to have than The Independent this week, which says that the NHS is collapsing. And these are leading medics apparently sort of staying in a corridor now is the norm. So on the week we should be celebrating, and MPs are doing runs and goodness knows what, it's far from a birthday, it's probably a funeral. And thank you very much to a tweet that was sent to me indicating that Southampton Hospital, all of a sudden, the public land of which the NHS hospital is on appears to have been sold with no public consultation. Now there are ANPR cameras being assembled, and it appears to be private land. So if anybody knows any more about that, do let us know.
Okay, Debbie, thank you very much for that. Let's change topics again. And